each session offers practical tools and real-world insights to help you in the great work that you all are doing. So I also want to acknowledge that this project is funded by the Maine Department of Health and Human Services, Office of the Behavioral Health through the Pediatric Mental Health Care Access Grant, and supported by the Health and Resources and Services Administration, HRSA. This learning series is also developed and delivered by MCD Global Health in collaboration with the Maine Pediatric and Behavioral Health Partnership. For this session, all participants are muted and the webinar is being recorded. A live transcript is available from your Zoom control panel. You either have it outside of the More option. You'll see a CC, an icon with CC, and those will be your captions. You can also type in any questions or comments that you have for the presenters in the chat box. And then we will be using the Q&A button for technical questions. So this is if your audio isn't working or you're having anything to do with Zoom, you can let us know. And at the end of the webinar, we do request that you stay online for 2 minutes to answer evaluation questions required by the funder. This is for the people that are able to stay towards the end of the webinar. So this webinar again is in partnership with the Maine Department of Health and Human Services, the Maine Pediatric and Behavioral Health Partnership, and MCD Global Health. And the presenters that will that are here today and are going to talk about building trust in care and strengthening patient engagement. We have Axel Samunto, who's a project coordinator for outreach and training at MCD Global. And Briella Nutangani, she's the maternal child and health coordinator at Maine CDC. And so we're really excited to have wonderful presenters that have a lot of lived experience and also work experience in the areas of patient engagement and working with the community. And so before we go into the presentation, I'm going to start them off with a warm-up activity, say a little icebreaker for this session. And so I want you all to imagine that you've just landed in a foreign country and you walk into a train station and the signs are in a language that you don't understand. The announcements are unfamiliar. And you're also not sure where to go next. And you have the ability to travel, but without the right information, you're stuck, right? And so I'm setting the scene for a challenge that I'm going to give. And so you will have in the next slide, the challenge is your destination is Brest, France. And you have 30 seconds to figure out which train leaves for your destination and what time it departs. And you also cannot use any translation tools. In a few moments, I know that the picture here is small, but in a few moments, you're going to see a larger picture of the schedule and you're going to hear a train station announcement with the steps and guidance for you to find your train. And so in the next slide, we have the larger picture, and I'm going to give you a few seconds to get acquainted with the screens and try to remember that you're going to Brest, France. And so I'm going to start. So remember that you need to find the train number and the departing time, and you're going to Brest, France. And so I'm going to start a 30-minute timer, and then I'll allow you to find it. So 30-second timer starts now.
Bienvenue à la station des trains Angelot. Attention, s'il vous plaît. Le train numéro 8623 à destination de Brest partira à 14h56, heure locale. Nous utilisons l'heure militaire. Attention. Le train numéro 8623 pour Brest part à 14h56, heure locale. Nous utilisons l'heure militaire. Merci.
So just a few more seconds for the 30 seconds, and the time is up. Did anyone find the train? And if you did, let me know in the chat. But I realize that it may be a little difficult. And so now let's imagine that you have a friendly local who's willing to help you to figure out this train schedule. And for the purposes of this activity, we're going to call them your guide. And they're going to make an announcement just like you'd hear in the station, in the train station. But this time it's going to be in English.
Attention, please. The train number 8623 to Brest will depart at 2:50 p.m. We repeat, train number 8623 to Brest depart at 2:56. Thank you.
And so now I'll give you a few more seconds to look at the screen again and see if you can find your train station. I'm getting some yes. And we can go to the next slide. And so I'll let your guide kind of explain a little more and make sure that you do have your right train.
Yeah, it looks like your train, it's 8623 and departing at 14:56 or 2:56. So it depends. Sometimes we use a military time that we call like the normal 24 hours. And here in the US, we use like the 8 p.m. format is like 12 hours. So if you look in our notes, you will see that it's different depending of the culture and the country you are landing. So I think, how did you feel about this exercise? I just want to open a stage and to discuss a little bit.
Yeah, you can take us to the, thank you, Axel's our guide, our French guide. And so now I'm looking at some of you for reactions, see how you felt. I want to hear about what kind of emotions did you feel while you were just thrown into a challenge, a 30-second challenge, and quickly find your train. You're already in a foreign train station, and the instructions are there, but they're in a language you may not understand. And so anybody want to come off mute or share in the, yep, I see you sharing in the chat already. I'm hearing some anxiousness, overwhelmed and stress, some panic. Yeah, definitely. Audra says, just listening to the foreign language while I was trying to find my train was overwhelming. Yeah. And some panic as well for Larita. And that's exact. And I didn't use any, I thought about using some background noise so that, throw in a little, another wrench into your situation, right? Of it's noisy, and recognizing that you're not having family disruptions, or, that you're not dealing with a lost passport, or where's your ID, and, all of other things that come with traveling, right? But I see some of the emotions that are felt. And so how did it change, or how did it feel when you had the guidance? You had an English translation, but not only that, you had a guide that said, hey, let me circle this for you. And I realized that the screen is a little small, but there was even a magnifying. If you can go to the next slide real quick, the previous slide, sorry, Axel's. The previous slide had the magnifying. You might have not caught it, but they even highlighted that for you, right? And made sure that you knew what train you had. And so I hear some people feeling more confident and comforting. Yeah, definitely navigating through difficult situations, but having a friend, having a guide, having someone that says, just with the military time alone, the 24-hour structure, I would already be like, okay, 40, what does that mean, right? So having the guide that said it's that 14 hours, but it's 2:56 p.m. Well, that's very helpful and more familiar to me, right? And so this simple train station example shows how the right support can transform an uncertain experience into a confident one. And so because this series talks about, or we're focusing on how patient engagement can be adapted or used to guide families into the American health system. And so very often we during our community health worker trainings, we talk about the American health system being almost like a foreign train station to folks, right? And so thinking of that activity in mind, in today's session, we're going to explore how to reduce uncertainty and how can we create that sense of safety for patients and build the trust that leads to better care. And so again, we have Axels and Briella that will guide us through this. And so I'll tee it off to Axels to continue with their presentation. Thank you all.
Yeah, good. Thank you so much, Christina. And then thank you so much to everyone who participated in this activity. So we want just to go first to the purpose of our session. First thing, the purpose of our session is to understand the importance of culture, okay? Respecting culture, belief, and using trauma-informed care practice in prenatal and early childhood health, fostering inclusive, like effective care, improve like child development, and strengthen family trust in healthcare system. And at the end of this session, we have 5 objectives we already assigned by ourselves. The first one is like, we'll be able to describe how culture, belief, and practice influence prenatal and early childhood health outcome. The second one is to identify the culture consideration that impact our family, analyze barrier and facilitator to culturally responsive care for new American family, also apply community-rooted culture-sensitive strategy to support positive health, developmental outcome in early childhood and build a trust. And at the end, we'll be able to develop action steps for integration culture understanding into everyday clinical and community practice. So for our first slide, we want to really understand who is a new American family. Because we are talking about culture, here it's like a Western culture. So we want to understand who is a new American family. The American family are immigrant and refugee family who are settling here in the United States, often navigating cultural, economic, and systemic challenge while building new life and contributing to their community. So this new American, as they arrive here in the US, they have a challenge and opportunity. It's not just challenge, they have opportunity too. So we identify couple opportunity and couple challenge that will just go a little bit in deep. First is the challenge. As we did an exercise with Christina, the first barrier is a language and cultural barrier. So it's very, very difficult when you land in the foreign country and you do not really understand the language. What you want to do, because the language is like the key. As someone said, panic, you could just panic for that. The second one is like a financial constraint, money, and then other resources that go around with the money. It's a big challenge for new American family. And at the end, because we are talking about the healthcare, especially here in Maine, we have a limited provider involvability. Some family just told you to have an appointment with a physician or nurse. They need to take 6 months or more than 6 months. Someone is here to find a primary care physician. It's a big issue, especially here in the state of Maine. And then this is a challenge the new American family are just encountered during their daily life activity. And we do have opportunity. We will not stuck just on challenge. We have opportunity too. One of the opportunity we already underlined is the community health program. As we are doing the webinar, we are doing a culture broker. Thus is the opportunity we provide to new American family. Like someone said, when I have someone who could just guide me, it will help me to remove the panic and all of that stuff. The second thing, we are in the era of AI, the technology and telemedicine help us to move with all of that stuff or to just go over the barrier the new American family could found, Like if we did not have a provider, we could have a telemedicine appointment, or we could just, if we did not have a transportation that would go with financial, we could just, at your home, you could have a consultation. And at the end, we have a policy and advocacy effort. Because we are a community, we could just advocate for our community, we could advocate for a new American family, and we want them to feel like they belong in this community. So to go a little bit in deep with our topic, we do just run a little pool about the building of the trust. Because of this stuff, opportunity and challenge, to put all of that together, we need to have a trust. And we'll run a little pool for you with one question: why trust matter in healthcare? And then you could just have a pool. It's just one question. You could just answer the question, and then you could just choose one of the points you want to know why trust matter in healthcare. One more. Okay, so just here, and this is the result. So to hear about the building trust, I will just hand to my colleague, Briella. She could just talk a little bit about the result we found in the pool, and then Briella?
Thank you so much, Axel. So before I want to just talk a little bit about the activity. It reminded me of when I first came here. It was in 2020, and I spoke English, but it was such a new environment that it felt too overwhelming and too stressful coming here and getting here. Whoever knows the Boston airport and how overwhelming it was, I was like, oh my God, where am I coming? Where am I going? Where am I coming? It's too noisy, everything. I was too overstimulated. So I get anybody who was overstimulated and was panicking. So why does trust matter in healthcare? I want to talk about everything. Trust matters because it does improve communication. When we not just patient and provider or patient and community health worker, we all love communication. When somebody is open with you and has an honest talk with you, it's the same with a patient and a provider. As a patient, I will need a provider to be honest with me. If maybe, let's talk about insurance, you do not have insurance, so this is how it's going to go, or let me refer you to an eligibility person, or you have this healthcare issues, this is how we're going to go. Just communicating as human beings, it does boost adherence. So patients are more likely to follow treatment plan when they trust their caregiver. For me, I see it as patients are more likely to attend their visit and trust their caregiver when their caregivers honor the patient point of view, or maybe the patient culture. I might be more into holistic culture where I'm like, I will take my ginger tea, I don't need the tablet. I will eat fruits, I don't need the vitamins. So just, again, it goes back to communication again, making sure we communicate this. How do you do at home? What do you normally treat this and this and this? So that's how I guess I see it. Enhances outcomes. So trust leads to a better cooperation, fewer missed appointments, and improved health metrics. When I trust you as a provider, when I trust you as a community health worker, even if you tell me, oh, you have to come every 2 weeks, you have to come every week, I would trust that you want the best for me and that you are looking out for me because you also respected whatever I brought to the table. Let's just a normal example, prenatal visits. I've seen it as a maternal health coordinator, but I also seen it in my community where here in the Western culture, we tend to go to the hospital every 2 weeks, every week when you're pregnant. And that's very, very different from how I know it at home. So I would need an explanation of why do I keep coming to the hospital? Why do I keep coming for an appointment? Is there something wrong? So just the trust will make that easier to cooperate and talk. And it also strengthens loyalty. A patient will trust their providers or their healthcare workers when they return and recommend services. Maybe I need help. Maybe I'm a new American. I do not have furniture. I do not have clothes. I need necessities. And you go your way, you recommend me or you refer me maybe to main needs, you refer me to furniture friends. I will more likely tend to listen to you and be like, okay, they're helping me not just with the healthcare issues, but also they're helping me with my necessities, my other needs. Next slide, Axel. As a maternal child health, I would love to talk about a little bit about cultural consideration in prenatal care. So what's the importance of culturally relevant education? In maternal health, or as I worked, I realized that education is key to anything. Educating somebody, not everybody doesn't know everything. So having that cultural sensitive education is key. What am I talking about? I'm gonna talk more into examples. So I'm a new American and I'm from Burundi. I'm from East Africa. I have my own ways of doing things. Maybe I do not like a male provider. So I would like a woman provider. But also maybe I have my own medication from home, which is very different from the medications here. And for me to leave that, I will need an explanation of why. Educate me on maybe why do you need prenatal vitamins? Why do you need to consult how is it called? Why do you need to consult a nutritionist? Because maybe my cholesterol is high or my blood pressure is high. I would love it goes back to education, but also communication. It's education between the two people, a provider and a patient. For me to learn from you, you have to know what I'm up to, and for you to educate me, you have to know what I was doing before. So that's also me educating you about how I was before in my healthcare. These are the key health practices and traditions. So it does include holistic approaches such as maybe African healing rituals, dietary habits, or promoting well-being and balance versus the Western prenatal care. What I've realized is the Western care and foreign care, it sometimes aligns. It's different system, but it does align. We all have one goal. It's just that we do different ways. So the communication of knowing what the other person, a new American family uses, or how does a new American understand this system or this healthcare? I think that's what is education. Education, I think it's between two people. I educate you, you educate me for a better healthcare system and a better conversation, I think. Next slide, Axel. I do have a case scenario. I'm gonna talk a little bit about infant safe sleep. As I was starting my work at the Maine CDC, I did not really know about safe sleep practices. For me, co-sleeping was a safe sleep practice. As a mother, you need that connection with your kid. You need to feel they're more safe when they're very near you. Then I get to my job and I get here where safe sleep is more putting a baby in their crib, checking on them, making sure they're not overcovered, and making sure I think I would focus more on the co-sleeping part, which was shocking to me as a new American. It was shocking to me because I've never heard about that. For us, we even carry them on our backs. Instead of carrying them in the front, we carry them on our backs. So in my head, I was like, oh, does that count as safe sleep? Or does it look like we're we're not caring. So I think this case scenario was I think a big shock for me, and it just showed how we need the education. We need the translated materials. We need to know how to also work best with the New American Family. For here, I would just give one resource. If you want to educate and maybe a New American family, they do not speak the language, they do not understand, I think hands-on demonstration can work. Open conversation. Show me how a baby, this is the crib. Some of them didn't know the crib from here. They never used the crib. So for them, it's not safe. Just showing them, this is a crib. This is how you put a baby to sleep on their back, right? And you tell them, show me how you will do it. Show me how you put your baby to sleep on a crib on their back. This is how you breastfeed, right? And at the next appointment, you ask them a feedback. How did it go? How did you feel about it? Do you like it? Don't you like it? Why don't you like it? Why do you like it? But at least, even without the language, you demonstrate it. We did not just use words, or we use a translator. You demonstrate and you show them. So that's education. And when they come back, they're like, well, I did not like it because this and this and this. Having an open ear, and again, educating. Try again next week and come back and let me know. And little by little, they will see what you're trying to tell them, but also giving them the why behind what you're trying to tell them is very important. So that's communication, honest and plain communication. Next slide. Community-centered approach. For here, I will use my success story, and I will use my own story as a community health worker. I used to work in a clinic, and we had a family. They were just getting married. They were very young, and they had a new baby. As they came once for their prenatal care, really once. They did not want to come for vaccines. They did not want to come for care. They did not want anything. And I think as a community health worker, as I looked at their case, and I was looking at how they're missing appointment, I speak French. I was like, okay, why don't you let me call them and speak to them? I think the way they used me, it's like a bridge between the provider and the patient. I called them and I asked, what's going on? You have missed more than 3 appointments. We're trying to check on your baby, and we're trying to check on you since it's the first month of your postpartum. She was like, well, I do not have transportation. And last time I called, they were like, you should take a bus. And I cannot take a bus. I have a baby. I don't even know where the bus is. I cannot walk to the bus. 2, I don't believe in the vaccination. Everybody told me that the vaccines will cause my baby to have autism. And 3, I do not feel well. I'm not in the mood to talk, and I'm not in the mood to move on. And my husband needs to go to work, and I cannot have a morning appointment. Well, as I was listening to all that, I was like, okay, there's solutions and there's a way to work it. I got them, since I was speaking the language, I got them another appointment. At that appointment, I got them a transportation, not a bus. We had Uber Health, so I got them Uber Health. And I also try to educate as much as I can with what I know, as I'm not a provider, that vaccines are not a cause of autism. And if that's a concern, she should come to the provider and talk about it and educate, because in her culture, that's what everybody was telling her. Oh my God, you're gonna go and get vaccines again? Your baby's gonna have fever. You know what fever comes from? The baby's gonna be sick, and you don't want that. So having that education, making sure that I am very open and honest, but also being sensitive to what she's feeling. And I also asked if she needed me to be in that appointment that day instead of a translator. Because sometimes you get a translator and they cannot translate. And I asked a provider if I can be in that appointment since the patient wants me to be there. She feels safe if somebody that they're from the same country or they have the same culture will be there. And that was, I think, an example of community-centered approach, being, I think, prioritizing trust and in the relationship, but also bringing my own lived experience, letting them know that I work here, I work at the hospital. I will not want you to be in any shape or form in a bad situation, and also talking their language, advocating for their family needs, getting them transportation. I think that's the community-centered approach, I think, should be between a provider and the patient. Or if we cannot be, because maybe time does not allow, using maybe community health workers, using medical assistant for that. Next.
Yeah, thank you so much, Briella, for show us how the prenatal or the community center could help us. So in this slide, I just really want to talk a little bit about the mix of everything Briella talked. I want to talk about culture, humility, humanity. And then here, if you look closely, we need a culture humility in healthcare system. Culture humility is recognized that patients are the experts of their own children, family, and culture. Having culture humility involves being open-minded, not just closed. You need just to be respectful and willing to learn from each person's unique background, as Briella say in previous case scenario and then example and her own experience. We are human, and then we need just to learn from someone else, and then that knowledge could help us to provide a better care. And then something I learned in culture humility, it say, I care about who you are, not just what you have. And then it make care more personal and respectful. It's encouraging open and strong relationship, because the relationship, the strong relationship is the first milestone of trust. And this leads to care that not only effective, but also relevant and empowers. And in culture, when you look the culture teach us who we are, because we came from Eastern, and then you came in Western. They have their own culture. We have our own culture. And what is the culture? The culture teaches us who we are. And then we want to mix the culture, humility, and humanity. And here, when you look inside of humanity, you will feel that the humanity reminds us who we all are, because the humanity is for everyone. West, Western, or Eastern, when they are together, it becomes a humanity. And humility, it helps us to grow into who we could be. It's very, very important to connect all of that. But sometimes when you try to connect one and another one, you could have a clash. Example, the culture could sometimes clash with universal human rights. And what you need to do, you need to look the pathway that could help you to navigate without hurt humanity or culture. Example, the tradition may conflict with human rights. In your culture, you did not take a vaccine. But here they say the vaccine, it's kind of human right. Every kid need to have a vaccine. It create a clash. But how you could avoid that clash? You need to understand. You need to learn for your colleague, or you need to learn for your peer, and then how they navigate with that. The second thing, it's when you look inside of culture and humility, the both it's create it create a cool connection. But sometimes humanity or culture without humility, it can lead to arrogance. You say my culture, it's more important than your culture. If you did not have that humility, it's become arrogant. That's why we have a kind of movement. This one say, we are superior than you, and then I'll say, no, you are not more than me. We are a human being created. All of that kind of stuff. We need to make sure when we use each word, it could just hurt or it could heal. And then as a healthcare provider, we need to make sure every word we use, every sentence we use, it will help us to create a trust and create a strong relationship. Also, in another entities like humility, it's lead us to appreciate our peer. It help us to celebrate the success of other one. It help us to move together and to achieve success. And then after this topic, I just found this image. It's skill and approach to build the trust. When you look, I see just 5 people there. Someone it's in like a little bit down, he need help. And someone in middle try to help, but that one need help too. And then we have 2 who is just watch other one. You will see like they do nothing, but they encourage other one to say, hey, great job, could you continue? You know, we could just participate in mean or another mean, you know, you could just say, okay, I did not do nothing, but the way you are living, it could just encourage someone to move forward with his life or to improve his kind of living. Also, to go a little bit far, I just try to go in the strategy to build a trust, because all of that, it reminds us who we are. In this slide, we will focus in 5 points. The first one is like the clear and empathy communication. To build a trust, the first strategy is like build your trust, communicate, have empathy communication, transparency and accountability in our act we are doing, culture competence and respect, empower through technology. Today, we are in era of AI, like I said before. We need to add the technology as one of the tools that will help us to build the trust, addressing social determinants of health. And all of that, I just try to go a little bit deep in each strategy to build a trust. In clear and empathy communication, we need to use a plain language to explain diagnosis and treatment. When you receive someone who did not understand the diagnosis, try to explain him in the way he could understand what really happened and what's wrong in his body. Active listening. Just don't come and let the patient what he need to do, and then you leave. Try to listen. Try to understand what is his concern, what really happened. Ensure the patient see familiar provider over time. The way to change a provider every time, it will just destroy a trust. It will not have a strong relationship with other people. And then a transparency and accountability here. The next slide talk about culture, competency, and the respect. Here, we recognize and honor diverse backgrounds and belief of each patient. Train our staff in culture sensitive to know what is a culture, as we say, empower through technology, and address social determinants of health. So, my next slide, I just want to talk a little bit about the strengthening patient engagement. And here, I just want to leave to my colleague, Briella. She could just go a little bit deep in the strength of patient engagement.
Thank you, Axel. So we talked about communication. Now we're talking about what's the move? What can we do? How can we strengthen the patient engagement? Next slide, please. Thank you. So in strengthening patient engagement, we saw 4 pillars of strength. We have shared decision-making, feedback loop, health literacy, and personalized care. For shared decision-making, I think inviting or involving a patient for a talk. So for me, I'm like, invite your patient into your office and discuss instead of recommending, instead of oh, I referred you here, I referred you here. Invite them in your office or give them a call to explain them the procedure, to explain them why did you choose the treatment and why does it help or why does it align with them and their values. In that sense, also aligning with their culture and everything. The feedback loop, regular collect and act on patient feedback. I think giving the space for a patient to give you feedback on the treatment or on the referral that they were given. I think giving them, maybe it's a survey or not just a survey, it's again a conversation. They come for their next appointment and you ask for feedback for how did the treatment go, how does it align with what you wanted, does it help you, and etc. Health, there's also health literacy, again, education. As I said, education goes both ways. As a patient, I educate a provider and the provider educating me. For that, educating a patient to understand their condition and care plans. If hands-on demos can be shown, I think it's best. For here, I have an example. I worked with a patient that had diabetes and they did not know that they needed the needles of insulin. So they did not know how to do that. They went to the pharmacy because the doctor was like, oh, here I did prescribe you a medication, go to the pharmacy and they will give you the medication. They give him the needles and like the little tube of insulin. They're like, why do I drink this? What do I do with all this? Because it was a diagnosis, it was the first time getting there. So they did not have a hands-on demo, they did not have demonstration on how to use it. So I think health literacy comes into that, educating a patient. Personalized care, not every patient is the same. And even if I come with symptoms of the other patient, not every patient needs the same services. Some individuals have preferences, maybe getting the appointment in prayer time when they're Muslim, or if you have to get them treatment, considering what they're in and what situation they're in. Next slide, please. We're going to move a little bit and talk about trauma-informed care in the New American. When we talk about also strengthening health, we have to consider that some of our patients have a lot of trauma or a lot of trauma-related conditions. When we talk about New Americans, they come from other countries, that they come to immigrate here or they come to live here. They have I think they have so much trauma related to migration. They have a lot of trauma related to resettlement or conflict or war. Some of them came from far and they walked for month and month. So those are the trauma. And I think these experiences can influence how they engage with the provider or how they engage with healthcare, which often does manifest as mistrust, and withdrawal and not wanting to come to appointment. Next slide. As I was saying, it's the same slide. I think as a provider or a stakeholder or a healthcare worker, recognizing that, making sure we collaborate with them, we talk with them, we empower them and encourage them to come to appointment no matter how they feel, and giving them the space to talk, giving them the space to also share. Next slide. Language accessibility, I think this is a big one. We all, as we saw in the trade, a different language can be very frustrating and very can bring anxiety and stress. So having a translator, if possible, letting them know, or you can bring somebody who can translate for you if they want to, or making sure we always have a translator on hand, on the call or in person, to help with the healthcare words. That way they can build trust and know that you are listening and their words is also getting to the other side. Next slide. The same thing, improving language access require multifaceted approach. So we should prioritize that, knowing that there are New Americans that do not speak the language. So using the trained medical interpreters or using your community health workers that speak the same language. That's a good use of them. That way they can help out, and also using visual tools and low literacy format. Again, pictures, hands-on demonstration, that can help a lot. Next slide. Reflection and action planning. I'll give you back.
Yeah, for reflect and action planning, we want just to have a call to action. So we have a couple of questions here. We'll read this question, and then after this question, you will just figure out and then what you could do. We want you to become a change maker. As we end today, we do have 4 questions. The first one is like, in your role, what does cultural humility mean? And how can it shape more trusting relationship with family? The second one is like, how can we ensure community voice, especially those of new American, are meaningfully included in program planning and decision-making? Our third question is like, what does trauma-informed care look like in your setting, and what could make it more effective for new American family? And our fourth question is like, what assumption do we need to challenge with our system to truly serve the new American family with dignity? I know we are already at the end of like our presentation, but I want if someone could just unmute himself, try to answer one question, or we could just put the comment in the chat. Then we just continue with our presentation. Someone will unmute himself, try to answer one question, and then we could just go over.
I can try the first one and say, you know, what does your culture of humility mean? So to me, the cultural humility is first listening to what they have to say and what is normal for them, and then trying to make that work in their current situation and their current plan.
That's good. Thank you so much, Stacy, for that reflection. And then I think your voice is like sounded well. And the next slide for us today is like, we want to say thank you so much for your attention. And then this is our contact. Mine is like asamuntu@mcd.org. And for Briella, it's like Briella and Tungane at maine.gov. So in our next slide, we just want to give a stage to our colleague, Melissa Morris.
Hi, thanks, Axel. Good afternoon, everyone. We just wanted to mention a resource that's available for you. The Maine Pediatric and Behavioral Health Partnership provides consultations for healthcare providers in the form of psychiatrics for pediatrics. So if there is a client or a patient who is in need of, and their practitioner is in need of assistance, they can call this line or enroll with us online at bhpartnersforme.org. And just like this education series, we have others that are available on our website for anyone who is interested as well. So thanks for attending.
Yeah, thank you so much, Melissa. And we'll just go to the next slide.
Oh, yes, so next week we will continue with this series, and we will be moving on to the topic of clinical approaches to sensitive health discussions. And so that's the same time next Thursday, the 21st, and we'll have 2 more in this series on August 28th and September 4th as well. So we hope you tune in.
Thank you, Melissa.
Yeah. And thank you so much, Christina.
Yeah, thank you so much. Thank you, Melissa, and thank you, Axel and Briella, for bringing all of the insight, right? It seems that we are going to finish a little earlier today, and that's perfect because some people do have to, leave. But I really want to thank you all for being part of the session and share it with your with your colleagues, right? And sometimes the providers that you work with aren't able to join them, but we will be sending slides and recordings so that, you know, if you took something from here, share it with a colleague, share it within your networks, and certainly there's upcoming sessions. And so we do have an evaluation poll that hopefully you can help us answer. There's a few questions. There's 5 questions, and you'll need to scroll down. And so if we want to make sure that we capture information of the topics, if it helped, and if you're looking for any other topics or discussions. And so I'll give you a few minutes to fill that out. And as everyone is filling that out, Axel, if you can show the next slide as well, so that we have our contact information for Axel and Briella is going to go in the email in the presentation that you receive. But if you have any questions about the full learning session or the series, please connect with us at MCD Zoom Tap at mcd.org. We are very glad to have you have participated. And again, you know, thank you for being here. Please share with colleagues. And we thank you for sharing in your evaluation insights as well. So I think we can wrap it up in a few seconds, Axels, but thank you all again. I hope you had a great lunch time with us. Thank you for spending time with us. And I hope you have a great rest of your day and a restful weekend. Thank you all.
Thank you.
Yeah, thank you.
Thank you.
Thank you.
Thank you. Bye-bye.
Thank you.